There are significant disparities in, it's not so much of a supply issue in the state of North Carolina of where healthcare professionals are located, but it's really a maldistribution issue. A lot of them are clustered to where the major hospital systems are, and in the case of nurse practitioners, based on how they can practice in North Carolina is holding them back from maybe going into rural areas.
That gets us into a very interesting situation that you've been writing about at johnlocke.org. Explain the relationship that nurse practitioners are required to have by law with a doctor.
Yes. So if a nurse practitioner is licensed in North Carolina, how they practice, they have to establish a collaborative practice agreement with the physician, and that sort of outlines, how often they'll meet every year, sort of the parameters of their patient population, the types of patients that they'll be managing, and their prescribing authorities. And so in a way, these nurse practitioners they're not tied to where a physician has to be, but they are overseen by a physician for certain things like prescribing authority. And it limits them from maybe locating in a more rural area if they want to. I mean, right now they can with that collaborative practice agreement, but it can be risky because the doctor may not feel comfortable with a nurse practitioner going to a clinic twice a week in a rural area, and if something's beyond her scope, the physician may feel uncomfortable because he's not there at that moment with the nurse practitioner.